Hello, I'm Dr. Asad Saleem. I'm a board-certified physician with years of experience in internal medicine and endocrinology. My passion lies in helping people understand their bodies and how to optimize their health through lifestyle and medical interventions. Today, let's talk about your metabolic health, a topic that's crucial for overall well-being, yet often misunderstood. We'll explore what it truly means to be metabolically healthy and why it's so important to pay attention to this aspect of your physiology. It's the engine that powers your body. It's the complex set of biochemical processes that occur within us, allowing us to function, grow, and thrive. Think of your metabolism as a high-performance engine, constantly working behind the scenes. This engine is responsible for converting the food and drink you consume into the energy you need to live, think, and move. It's the process that fuels every single activity you undertake, from the simplest tasks like breathing to the most complex, like running a marathon or solving a difficult problem. When this engine runs well, efficiently, and smoothly, you feel energetic, vibrant, and healthy. Your body is able to effectively utilize the nutrients you provide it, maintaining a stable internal environment. But when it falters, when it becomes sluggish or inefficient, a cascade of health problems can follow. This can manifest in various ways, impacting your energy levels, weight, and overall well-being. Metabolic health isn't just about weight, although weight management is certainly a component. It's about how every single cell in your body gets the fuel it needs to function optimally. It's about the intricate dance of nutrients, hormones, and enzymes working in harmony. Hormones and enzymes work together in a complex interplay to keep this system balanced, ensuring that your body is able to effectively process and utilize energy. They are constantly communicating, telling your body when to store energy for later use and when to release it to fuel your activities. For example, insulin, a crucial hormone, helps your cells absorb sugar from the bloodstream after a meal, preventing blood sugar levels from spiking too high. If this process breaks down, if insulin is not working effectively, or if other hormonal imbalances occur, metabolic disorders can develop, leading to a range of health complications. Understanding the intricacies of your metabolism empowers you to make informed and better choices about your diet, your exercise routine, and your overall lifestyle. Today we'll break down this complex topic into simple, digestible parts, making it easier for you to grasp the key concepts. We'll discuss what happens when things go wrong with your metabolic processes, explore common metabolic diseases that affect millions of people worldwide, and learn how to recognize their often subtle but important warning signs. We'll also cover the various methods doctors use to diagnose these issues, from blood tests to advanced imaging techniques. And most importantly, we'll discuss what you can do, both through lifestyle modifications and medical interventions, to effectively manage these conditions and improve your metabolic health. My goal is to give you clear, reliable, and actionable information so you can take charge of your health and make informed decisions about your well-being. Let's get started on this journey to better metabolic health. What exactly are metabolic diseases? These conditions represent a wide spectrum of disorders, each with its unique impact on the body's intricate biochemical processes. Imagine your body as a highly efficient factory, constantly working to convert the food you consume into energy. This energy fuels every action, from breathing to complex physical activities. The body also uses nutrients to create the building blocks necessary for growth, repair, and overall life maintenance. A metabolic disorder is like a breakdown on the production line, a glitch in the system that disrupts the normal flow of these essential processes. Maybe your body struggles to effectively process sugar, leading to elevated blood glucose levels and potential complications. Or perhaps your body produces too much or too little of a crucial hormone, throwing off the delicate balance required for optimal function. Sometimes these issues are deeply rooted in our genetic makeup, inherited from our parents and predisposing us to certain conditions. Other times, they gradually develop over time, influenced by lifestyle factors such as consistently poor dietary choices or a lack of regular physical activity. Metabolism, the engine of our bodies, has two main parts. Catabolism, the process of breaking down food into smaller components to release energy, and anabolism, the process of utilizing those smaller components to build and repair new tissues, essentially constructing the body. Metabolic disorders can disrupt either of these critical processes, leading to a cascade of health problems. For example, if your body has trouble breaking down fats, it can cause harmful buildup in the arteries and other tissues, increasing the risk of cardiovascular disease. Conversely, low hormone production, such as in hypothyroidism, can significantly slow your body down, leading to fatigue and weight gain. These imbalances, whether subtle or severe, can affect everything from your daily energy levels and mood to the long-term health and function of your vital organs. That's why understanding, identifying, and addressing metabolic disorders through appropriate medical interventions and lifestyle adjustments is so incredibly important for maintaining overall well-being and preventing serious health complications. Let's take a closer look at some of the most common metabolic disorders that affect people worldwide. Understanding these conditions is the first step in managing and potentially preventing them. We'll explore how they impact the body's intricate processes. Type 2 diabetes is a widespread metabolic disorder that happens when your cells gradually become resistant to the effects of insulin. Insulin, a crucial hormone, is responsible for ushering glucose from the bloodstream into cells for energy. As a result of insulin resistance, glucose struggles to enter the cells efficiently, leaving too much sugar circulating in your blood. This elevated blood sugar level is a hallmark of diabetes. Over time, this constant state of high blood sugar can wreak havoc on your body, straining your organs, including the kidneys, heart, and eyes. The long-term consequences can be severe. Thyroid disorders are also remarkably common, affecting millions of people. These disorders involve the thyroid gland, a small butterfly-shaped gland in the neck that produces hormones regulating metabolism. Hyperthyroidism occurs when the thyroid gland becomes overactive, producing excessive amounts of thyroid hormones. This hormonal surge speeds up your metabolism significantly. Conversely, hypothyroidism arises when the thyroid gland is underactive, leading to insufficient thyroid hormone production, which slows it down. Both hyperthyroidism and hypothyroidism disrupt your body's delicate energy balance, leading to a wide range of symptoms and health complications if left unaddressed. Metabolic syndrome is not a single disease, but rather a cluster of interconnected risk factors. These risk factors include conditions like high blood pressure, excess belly fat, particularly around the abdomen, and elevated high blood sugar levels. When these factors occur together, they significantly raise your overall risk for developing serious health problems like heart disease and type 2 diabetes. In addition to these common conditions, there are also some rare inherited disorders, such as phenylketonuria, often referred to as PKU. PKU is a genetic condition that prevents the body from properly breaking down phenylalanine, an amino acid found in protein-rich foods. If PKU is left untreated, the buildup of phenylalanine can lead to serious health issues, including brain damage and developmental delays. Early diagnosis and dietary management are crucial. While these metabolic conditions may seem diverse, they all share one fundamental thing in common. They all involve a disruption in the intricate processes of how your body efficiently turns the food you eat into the energy it needs to function and the essential building blocks necessary for growth and repair. Spotting metabolic disorders early is key. For diabetes, watch for constant thirst, frequent urination, fatigue, and hunger. Signs your cells aren't getting enough energy. Hyperthyroidism can cause weight loss, rapid heartbeat, sweating, and anxiety. Hypothyroidism may lead to weight gain, tiredness, feeling cold, and dry skin. Metabolic syndrome often has no obvious symptoms, but a large waistline is a visible warning sign. Many symptoms are subtle or overlap with other conditions, so regular checkups are crucial. If you notice persistent patterns, like unexplained weight changes or ongoing fatigue, talk to your doctor. Early recognition and action can make a big difference. Doctors use blood tests and measurements to diagnose metabolic disorders. For diabetes, fasting blood glucose and hemoglobin. A1C tests reveal your average blood sugar. Thyroid disorders are diagnosed by checking TSH and thyroid hormone levels. Metabolic syndrome is identified by measuring blood pressure, triglycerides, HDL cholesterol, blood sugar, and waist size. If 3 or more of these are abnormal, you may have metabolic syndrome. Sometimes, imaging like thyroid ultrasounds helps clarify the diagnosis. These tools help doctors pinpoint the problem and guide your treatment. The good news? Most metabolic disorders can be managed. Treatment often combines medication and lifestyle changes. For diabetes, medications like metformin and sometimes insulin help control blood sugar. Thyroid disorders are treated with hormone replacement or medications to balance hormone levels. But lifestyle is just as important. A diet rich in whole foods and regular exercise can stabilize blood sugar, improve cholesterol, and boost energy. Even a brisk daily walk and healthier food choices make a big impact. By combining medication with these habits, you can take real control of your metabolic health. Managing your metabolic health is one of the best things you can do for your future. Your metabolism powers everything you do, and when it's off, your body sends warning signs. Don't ignore them. Diagnosis is straightforward, and effective treatments are available. A balanced diet and regular activity, along with medication when needed, can help you thrive. Remember, a diagnosis isn't the end, it's a new beginning. Every healthy choice is a step toward a better life. Thanks for watching. Stay healthy and take charge of your well-being.